Good day to you all. I am Ezekiel Adego, and I'm here to deliver a presentation on my dissertation in part fulfillment for the award of master's degree in data science by the Leeds Beckett University. The title of my dissertation is Investigating the Early Prediction of Dementia Using Machine Learning. And this dissertation has been supervised by Jacqueline Campbell. The investigation into the prediction of dementia was necessitated by dementia being identified as one of the most challenging medical conditions facing our society today. It has been projected that by the year 2050, 131 million people and above will be estimated to be living with dementia. Furthermore, dementia has been identified as the seventh leading cause of death worldwide, and as a matter of fact, in the year 2022, dementia was identified as the leading cause of deaths in the United Kingdom. Also, the cost of dementia financially has continued to rise, and it is projected that by the year 2050, the cost of dementia treatment will be estimated to reach £50 billion in the United Kingdom. Clearly, all these socio-economic impacts have necessitated an urgent need to do for more research to be concluded in the study of dementia. Dementia is a syndrome that is accelerated by the presence of comorbidities. Comorbidities are just a collection of underlying diseases that are identified as risk factors that progressively damage the human cognitive functions. Therefore, it is necessary for the detection of dementia at the earliest possible stage within a population, and this is a key strategy to slowing down the rate of progression to all-cause dementia and reversing these socio-economic trends. Based on this study set out to achieve the following objectives. The first is to explore relevant literature on the use of machine learning models for dementia risk prediction. This study also set out to identify a proper data set for predicting dementia risk levels for more research. This study also set out to undertake exploratory data analysis on the various risk factors contributing to cognitive decline. We also set out to investigate various machine learning techniques that can be used for dementia prediction and to identify significant modifiable risk factors for dementia outcomes. Finally, we also wanted to do a qualitative evaluation on the appropriateness on the use of machine learning techniques in predicting dementia risk levels. In order to achieve all these objectives, a literature review was necessary, and the literature review helped us to understand the various types of dementia which we are going to be studying. It was discovered that 70% of all cases of dementia are defined as Alzheimer's disease, while the rest, Lewy body dementia, vascular dementia, and mixed dementia make up the rest 30% of dementia cases. The literature review also reviewed information about modifiable and non-modifiable risk factors that are associated with dementia. We discovered that risk factors such as age and genetics are non-modifiable risk factors, while factors such as hypertension, weight, lack of exercise, smoking, alcohol consumption, depression. They are modifiable risk factors that can be worked upon to delay or prevent dementia outset. We also discovered through our literature review of various machine learning techniques, data sets, and performance metrics that have been used in the study of dementia over the years, identifying various ones such as support vector machine, logistic regression, linear regression, and what have you, the various types of machine learning techniques. So this essentially gave us more confidence to proceed into the study that investigating dementia using machine learning can also be achievable. What are the methods we wanted to use to achieve this? Our methodology was built around the cross-industry standards approach, the CRISP DM for data mining, that allows us to clearly identify our business understanding and all understanding the data, and we all go into the experimentation and the evaluation process of the research. So using the CRISP DM, we're able to build a comprehensive project plan for the implementation of this research. We are also able to identify a data set, the National Action Coordinating Center, which is an institute of the study of dementia from the National Institute of Aging, which is domiciled at the University of Washington, D.C., USA. And this institute have graciously gave us access to the data set that was used for this experiment. Initially, the data set contained about 1,024 features, but due to time constraints, we consulted with domain experts in dementia research, and we narrowed down the features to be used in this experiment to 21 features related to the risk factors that are both modifiable and non-modifiable risk factors that have been identified in our literature review. The following activities were conducted in the experiment. Our first task, after loading the data into the Google Colab computing environment, was to do some descriptive analysis of the data, helping us to explore the proportions and the distributions of dementia risk factors. We also implemented some inferential statistics on the data that helps us to understand the level of significance and whether there is correlation between risk factors in the dementia dataset. We furthermore, and figure 6 here gives us a brief overview of the content of our dataset. In the dataset that we have, these are the proportions of the various dementia risk factors, and ideally we would like a situation where more people would remain as normal cognition, and more people who have been diagnosed with questionable impairment will seek to identify certain risk factors which can be worked upon to enable them even move towards normal cognition. So that is the essence of this entire study. Also, furthermore, going ahead in the study, we also identified various machine learning techniques that will be used to accurately predict dementia levels. Various machine learning techniques were experimented with, and we must reveal here that not all of them was able to analyze the data effectively as we desired, but out of the lots which were tested, the ones that gave us results, classification results, were these k nearest neighbors, decision tree, random forest, extreme gradient boost, and multilayer perceptron artificial neural networks. These were the 5 that gave us positive outcomes, and we move forward into the research with these 5 by constructing each of these machine learning classifiers and using them to correctly predict dementia risk outcomes. And these 5 classifiers gave us accurate prediction of varying degrees, which you will see later. But before we go into them, let's just see the results of our implementation. For example, this chart here, figure 5, gave us the distribution of the age within the data set. Figure 7 here gave us the results that we obtained from our investigation into correlation between the dementia risk factors. Figure 8 here, figure 6 here gave us, this is a typical sample from one of the evaluation classification reports obtained after we fitted the model into the data set. Figure 9 here is representing the confusion matrix that was part of our evaluation. Our performance metrics was the confusion matrix, and this confusion matrix obtained from the XGBoost was the best performing, returned the best performance when confusion matrix was used to evaluate the models. By the way, this classification report represented the report obtained from the decision tree classifier when we under validation. So the decision tree classifier returned the best result in terms of accuracy. The XGBoost classifier returned the best results when we use confusion matrix, while the random forest classifier returned the best mean ROC score when we use that evaluation metric to compare each of these models. So essentially, on the same data set, we had 3 classifiers trending best in different classification indices. It was these results that we obtained here gave us a better insight into what the next stage of our experiment will look like. And the next stage of our experiment was to see how we could harness the collective strengths of all these best performing classifiers to help us to achieve better predictions in dementia risk levels. So our next task was to apply dimensionality reduction to see if whether by reducing the number of features available to train these machine learning models, we could achieve a better result. The dimensionality reduction technique that was employed in our improvement experiment is called the recursive feature elimination technique, that essentially takes all the models and begins to experiment with them one by one, and as keeps eliminating the least significant model in that data set, and we use the cross-validation to validate the performance of that model. This experiment was conducted using the XGBoost, using the decision tree, and using the random forest classifier. So each one of them posted their results, and we discovered that the random forest classifier reduced the number of features to 15 and also gave us a cross-validation score of over 90%, and hence that feature reduction was chosen. That is why here we displayed the most significant features from the random forest, and we used the top 15 to train our model in our next experiment. The next experiment involved constructing an ensemble machine learning model. An ensemble machine learning model allows us to build an ensemble of machine learning techniques, and this was now going to use to do dementia prediction. The ensemble machine learning we experimented with different configurations of base models, base estimators, and final estimators for us to try and see which one is giving us a better performance in prediction. And we fitted the model, the ensemble model that was constructed using the different configurations. And first configuration is this table here shows us the configurations of the ensemble models that were built to perform the second set of experiments, and also the accuracy scores obtained from each one of them. You could see when comparing the performance, the accuracy score of the ensemble machines with the individual machine learning models, we could see that the ensemble machines perform better than the individual models. So based on accuracy, we concluded that the ensemble machine, and in particular the ensemble machine with configuration M4, outperform all the others. Also, if we are going to compare the classification metrics for the assemblers and the individual machine learning models, you could see that the assemblers have a higher performance in accurately classifying dementia risk levels, particularly if you noticed in the individual machine learning model, they all experience a sharp dip when it comes to the recall rates, but this was corrected using the ensemble machine learning model. And even though there's still a dip, but it is not as sharp anymore, improving the recall rates for the ensemble machine. Furthermore, this here highlights the confusion matrix from the best performing ensemble model, which is the M4, and you could see when compared to the best performing model for the individual configuration, which is the XGBoost, it actually performed better. So we're able to now bring our research to a successful conclusion with the following. Firstly, in our exploratory data analysis, we're able to identify significant features in the NACC dataset, but the relationship could not be determined because the relationships are inherently non-linear. So we needed a technique that could unravel non-linear relationships to help us for prediction. And that is why the second point, which is the machine learning, was successful in exploiting the nonlinear relationships between the features to accurately predict dementia risk outcomes. With the KNN identified as the least performing, the decision tree was the best performing when accuracy is considered, the random forest best performing when the receiver operating characteristic score is considered, and the XGBoost best performing when the confusion matrix is considered. Having three different models performing well across three different metrics helped us to build our ensemble model. And in building our ensemble model to achieve a better performance, we also applied dimensionality reduction to the data set, and we trained our ensemble with the optimized data set of 15 features, and it gave us a better performance, specifically, the ensemble model that consisted of random forest, decision tree, and XGBoost as the base estimator, employing ANN, artificial neural network, as the final estimator, performed better in all performance metrics of accuracy, classification, precision, recall, and F1 score, and also in the confusion matrix. It performed better, and it is identified as the best performing machine learning model for predicting dementia risk factors. Having come to this conclusion, we are now able to come up with some recommendations, because we have a tool now that can be used to predict dementia risk levels of people, and this tool will enable healthcare practitioners design targeted health intervention strategies at the earliest stage of dementia, especially for those who have been diagnosed with questionable or mild cognitive impairment. Imagine the number of people from our data set here. Those in questionable and mild cognitive impairment account for almost 70% of the data set. So imagine that potentially we have a tool that supports early detection of dementia for 70% of people, allowing effective healthcare strategies to be administered to them. Also, we are able, through this tool, healthcare organizations will now be able to offer dementia pre-screening for all populations that are inexpensive, irrespective of their socio-economic status. They will be able to have dementia pre-screening that will help us facilitate early diagnosis of dementia risk levels across all populations. Finally, through this tool, we will now be able to address to deliver socio-economic benefits to the society, such as lower dementia-related death rates and bringing down the economic costs that are associated with dementia. So we also had a list of future works that came in the research, such as more research being able to come up with a building of dementia early warning systems that people can go and can make use of it to understand their dementia risk status and take necessary steps to be able to redress the progression of dementia. Thank you very much. This recording is available on YouTube, and the product is also available on GitHub through the links that have been provided in this document. Thank you very much for giving me the time to do this presentation.